Okay, so my name's Rachel. I'm going to be your nurse today. I have an order here for Kim Smith. Her date of birth is 9/15/74, and we are going to be straight cathing per the doctor's order for urinary retention. So I will enter the room, introduce myself, Rachel. I'm Rachel, the nurse. Can you tell me what your name and date of birth is? I will then also verify that the name and date of birth matches on the armband. And then I'm going to explain today that I'm going to be doing a catheterization on you today. The doctor has ordered for me to put a tube into your bladder to drain it, and hopefully that'll make you feel a little bit more comfortable. Do you have any questions about the procedure? Okay, so first what I'm going to do is we're going to get you, I've got you draped here. I'm going to have to just look at your anatomy and get you nice and clean. We don't want you to get any infections. And then I'm going to have you lay on your back. We call that the supine position. And you're going to draw your knees up, and then you're going to lay your knees out and relax your hips. I don't want you to be uncomfortable, but I do need to be able to get in there and use my equipment. So first thing I'm going to do after I've identified the patient is I'm going to perform hand hygiene. Gloves, and we'll pretend like those didn't just rip. I would definitely replace those if that happened in your life. Okay, so I'm gonna just have you draw your legs up, and then you'll have your knees just fold out gently, okay? And now what I'm going to do is I'm gonna lift this drape up so that I can have a look here. I've already made sure that the door is closed, the curtains are closed, and no one can see into the room. It's just us. I'm going to take a peri-wipe, and we're going to clean the garbage under here. And then over the meatus. I'm going to remove my gloves. Move the wipes out of the way. I'm pretending that this is a bedside table that I have kind of to the side here. This wouldn't be next to my sterile field this close, but space is limited in my house right now. Okay. There you go. Okay, 2.5 to 5 centimeters of the edge of the catheter. And that lubricant was very watery. It's not usually that watery. I'll bring this over. And I'm right-handed, so my left hand is my non-dominant hand. I would spread the labia and with my swabs, I will wipe the labia minora furthest from me first. Closest to me next. And then I'll swipe down the meatus. So then my lubricated catheter, I'll pull and let my patient know you're just going to feel a little bit of pressure. I'm going to take a deep breath in and blow out, and when you blow out, I'll be inserting. It'll only be a moment, and then you should feel some relief. Okay, so take a deep breath in and blow out, and you're going to feel pressure. And then I should have urine. Once I see a little bit of urine, I'll wait and then advance the catheter just a little bit further. And then have it empty. And once it is empty, I would slowly pull the catheter out. And then take this, we would take it to the bathroom or wherever, put it aside. We'd use this as another wipe to wipe off any of the excess lubricant or any of the betadine that was left there. Take a fairy wipe and just wipe to make sure that there's no more excess lubricant in there. I would replace the drape, put the patient in a comfortable position, raise the head of the bed, place the arm or the side rail up, make sure that the bed is at its lowest position, and then I would measure the urine and empty it into the toilet. And I would make sure that the patient was comfortable and ask if they needed anything prior to me leaving, and then I would document in the chart exactly how much urine I was able to get and how the patient tolerated the procedure. And that's it.